Hey guys, Dr. Ray Marque here, your local chiropractor at Back Pain Relief Center. I'm coming to you from our Murrells Inlet location today down in South Carolina. As many of you know, I have two locations, one in South Carolina and one in South Jersey. So this kind of goes for everyone out there. Today we're going to talk a little bit about how to treat low back pain. So far this week, I've already had three new patients with very similar conditions when it comes to low back pain, and they all had a little bit of back pain but had a lot of leg pain, so pain going all the way down the legs. So after we reviewed what was going on, reviewed some MRI reports, did an exam, and identified the problem, knowing that it is sciatica, we talked a little bit, and all three of them have been to other doctors and we're still dealing with the pain, and it was getting very frustrating for them. So I guess I'll talk about one, but they were all very similar. Many times when you get to the point where you have sciatica, that means that that low back has been ignored for a little while. Possibly you've had some pain coming and going over months or maybe even years, and it was ignored or not treated properly. And now you have this full-blown sciatica, so pain shooting down the leg. And you go to your primary doctor, or maybe you go to an orthopedic or another specialist, and they do the things that they do. So they give you some muscle relaxers, possibly some pain medication, maybe even an oral steroid or something to try to get the inflammation down to get you to feel better. Even on the higher end, possibly some steroid lumbar epidurals to try to get inflammation and pain down and try to get that pain to stop. Now look, they're all doing a great job, and I'm a big fan of the orthopedics when it comes to sciatica and back pain, because there's a time and a place, and many times it's very appropriate to do what they're doing. But it doesn't always give you the results that you were looking for or hoping for. Now many people feel great after it, so get an injection, or maybe they take an oral steroid, or they take a little bit of medication for a week, and boom, they feel good, they're back to work and back to doing the things they're doing. And that's great, but there are cases like the three people that I saw this week where they do that stuff and it still doesn't go away, and they're coming to me looking for another reason or some hope to try to get to feel a little better. Because in the long run, everybody just wants to feel better. Everyone wants to get back to work, or everyone wants to get back to doing what they like doing, and they just want to feel better. So we have to ask ourselves, why, when we go to these specialists, doesn't it work? So you're going to someone who you think should be able to get rid of your back pain, and we're going through these procedures or doing these things, and it's still not going away. And even with one of the patients, they got to the point where said, hey, well, you're going to need surgery. And maybe surgery is appropriate, but maybe it's not. And I would use surgery as the very last thing that I would do. I would try absolutely everything out there. So again, how do we treat back pain? One of the things that I think you need to do, if you're not getting the appropriate amount of relief, or the relief that you want to get you to a good spot when seeing one doctor, get some other opinions of other things to do. Sometimes when you combine different specialties, that's what you need to get you to where you need to be. Hold on one second there, I got a question there. As of March 1st, I'll have fries in New Jersey. All right, dear, we'll see you then. Getting back to this, so sometimes it takes getting multiple doctors in different, different professions in order to get you to feel better. And let's go over why. In general, there's two main reasons for back pain, at least the types that come across my desk. Number one, we have a biomechanical reason, and that means that the joint, for some reason, throughout the years has become dysfunctional, whether that's through the repetitiveness of your job, or whether it's your genetics, or whether you're in an accident and something made that joint not work right. Just not working right will cause pain. But when it stays like that for a while, the biomechanical aspect of that being dysfunctional makes your joint begin to dysfunction, it begins to degenerate, it becomes arthritic, it becomes inflamed, and it causes pain. So a joint not working correctly, biomechanically or functionally, starts a degenerative process which becomes inflammatory and dysfunctional and causes pain. So a biomechanical reason. After that biomechanical reason has been there for a while, it creates a chemical reason. It brings up inflammatory markers or inflammation that in itself will cause pain. So for the most part, your medical doctors, whether it be a primary or an orthopedic, are going to treat that chemical reason. And they're going to give you medication, they're going to give you injections, or whatever they do, what they think is appropriate for you, which is a good idea, and you need to get that inflammation down. But if you never address the biomechanical reason of the problem in the first place, once the medication wears off, it may come back. Now, with some people, when the medication wears off, it doesn't come back, which is great. But for others, it comes back. So we have to ask why is it coming back and what do we need to do? Well, you need to address the biomechanical reason. So spinal manipulative therapy or chiropractic care has been proven to be a safe and effective way to treat the biomechanics of that spine in order to bring back function, decrease compression, to get the inflammation down, get the joint working better. So now maybe the medication or the injections or whatever they may be doing you work better. I'm a big fan of combining the two professions. So in conjunction with some appropriate spinal manipulative therapy, some myofascial or muscle work, some therapy on that back, in conjunction with some medication that's appropriate from your doctors, then it begins to work better. So with the 3 patients I saw, they all were doing the chemical reason. So they were all seeing the medical doctors and they were getting the medicine, but still weren't getting to an acceptable level of relief. I think I've seen the one a couple times and the other 2 once, and they're already beginning to feel better, because when you combine the medication with spinal manipulative therapy and chiropractic care, we can get you to that spot that you want to be faster. Okay, so I guess the point of this whole talk was, if you're not getting the success that you would like to get with one particular doctor, reach out, look for other doctors, and try to combine biomechanics and the chemical reason, or I should say the medical reason, to get pain down, and that should help you get to the point that you need to be. All right, I hope that helps someone out there. Again, if anyone has any questions and they'd like me to answer them, just message me on Facebook or comment on this video. I'll make sure I get back to you. We can talk about your pain. I may or may not be able to help, but I'll give you an honest opinion if our therapy will be able to help you. If I can't, we'll get you to the people that can. All right, so if anyone needs to get a hold of me, you can check me out on Facebook. We're also on YouTube. You can see us in South Carolina at Murrells Inlet Chiropractic.com. Again, that's Murrells Inlet Chiropractic.com. If you're up in New Jersey, it's backpainrc.com, backpainrc.com. And Heather, thanks for watching, okay? Appreciate it. If you have any questions, just let me know. Everyone have a great night, and I'll talk to you guys tomorrow. Bye-bye.